Welcome to ADAPT NCLEX. Conflict resolution, which is part of management of care, is always a problem. The words sound the same, they look the same. It's difficult to figure out what is the right answer. Stick around if you want to learn something. This is the conflict resolution question. What strategy does this represent? The nurse is scheduled for a training session but agrees to swap shifts with the coworker or requests the same day off for a personal reason. Look at it. She's scheduled for a session, but somebody wanted a day off because of personal reason. This is not collaboration. We are not collaborating and coming down in the middle, right? And getting all our information 100%. This one nurse is accommodating another nurse for a personal reason and then sacrificing her own views. Avoidance is not avoiding that. And compromising means we have 50-50. There's no 50-50 there. One nurse work, the other one get off. Therefore, the right answer is a key concept you need to memorize and know understanding. This is accommodation right here. So number 2 is the right answer. And next, notice tension between two colleagues, but chooses not to intervene or mention it to the manager. What conflict resolution is being demonstrated? She's avoiding, she does not want to involve in the conflict. She's not compromising. There's no 50-50 here. There's no collaboration. There's no 100% of each. This is avoidance, avoiding the whole thing, does not want to get into it. She doesn't even want to think about it. This is conflict. There's no competition here. So this question is basically is an avoidance. She's trying to avoid each one of them and does not want to get involved. These questions are straightforward, but you have to know the content. Two team members argue over who will lead the committee. The manager suggests they share responsibility by alternating leadership, right? We share responsibility. Nobody is getting 100%. Today you are the leader, tomorrow I'm the leader. It's a 50-50. We are compromising, right? We are compromising so that we can become leaders. There is no collaboration there. There's no competition. Initially, there was a competition, but now we have 50-50. This is compromise. And then the last question, a multidisciplinary team disagree on the best way to implement new patient care protocol. They decided to host a meeting, everybody come together, where all viewpoints, your viewpoint, my viewpoint are discussed and consensus is reached. That means we all get what we want. It's a form of collaboration. This is ADAPT NCLEX. This is the way I want you to think about. So this is it. Number 1 is the right answer. This is the way I want you to think about conflict resolution.